So this topic is a little sticky. So we're going to be talking about obviously bowel movements. So it's important that if you're with your patient often, you know their bowel movements. Do they have a bowel movement once a day? Do they have a bowel movement once a week? Normal is no more than 3 times a day, and that is a lot, and no less than 3 times per week. Okay, so more than 3 a day can mean that they're having diarrhea, and less than 3 a week can indicate that they are constipated. And it's not necessarily urgent, but it's something that we need to know. Okay, so if that's something you can monitor, if you have that opportunity, if you're with your client day in and day out, watch that. You know, okay, as well as if you get the opportunity to see the actual stool, do take note on the color, the consistency. So this is not the best topic to talk about, but it's important because if the stool is black and tarry, this can indicate that there's bleeding somewhere in the digestive tract, okay, and it's not good. It's usually higher up in the digestive tract, which is not a good situation. So let us know if you're seeing that at all, okay? Also let us know if it's really watery and it's not formed and it's, you know, they're going to the restroom more than 3 times per day. It's happening, you know, every couple hours they're needing to have a bowel movement. Okay, that's something we need to know too, because with elderly, if they're having diarrhea, it can cause dehydration. They need to be getting fluids, and it can be an emergency situation, something that we need to know. Okay. A little bit more about goes into this about nausea and vomiting. If someone has the stomach flu and you know they throw up they're vomiting or they're nauseous, we know that that's normal to the stomach flu. But if it is uncontrolled and if it's not relieved after a certain amount of time, we need to know about it. Take note on the color and the consistency of this, we call it emesis, but of this throw up. If it looks like there's coffee grounds or dirt in it, that's something we need to know about. That is also, you know, an urgent thing. It can indicate bleeding as well somewhere, okay? And take note on the pain too. Where is the stomach pain? You know, is it in the upper right quadrant? Is it in the upper left, lower right? Know where it is and then let us know. Is it relieved by having a bowel movement? Is it relieved by passing gas? If it is, then it was just gas, or they just had to have a bowel movement, okay? But the key thing is to know how long is this going on for. Take note on the time, when they first tell you, and take note on if it's relieved or not relieved by certain things. Also, what are they eating? Have they eaten today? Are they hungry? Is it just hunger pains? Have they had anything to eat? Maybe they ate something that was bad. It's always tricky with the stomach because they could have eaten something that was bad and have, you know, a 24-hour stomach flu or a bug, even an 8-hour stomach flu. And that isn't fun, and you know, you can be throwing up constantly when that happens. But just let us know if you're unsure. Is there any questions on what to watch out for with digestion in the stomach